Welcome to Temasek Polytechnic's Virtual Open House 2021. I'm Dr. Nyopeti, the resident veterinarian of TP Animal Clinic and Wellness. Today, I'll be running a virtual workshop and I will show you guys how to do a basic physical examination on your pet. This is one of the very basic skills that we teach our students who are doing the Diploma in Veterinary Technology in their practicals. It will be a really shortened form, and if you do have a pet with you, I hope you have fun. And this is going to be quite helpful to you where you start to determine what is normal and what is abnormal for your own pet. And today joining me, I have my own pets with me. This is Kioi. She's a 4-year-old female border collie, and I have Aki, who is a 5-year-old female Maltipoo. All right. And I do also have Bam Bam because I know that not every one of you will have dogs and cats. But this is going to be just a general basic check where you can apply with slight modification to the type of pet you have at home. Well, Kiki, you're all ready, right? All right. So this basic physical exam is a head to tail examination, and with practice, you can finish it within like 30 seconds, and it can be a daily check so that you can know whether your pet is in a healthy state or if there's something wrong that requires veterinary care. Okay, like they say, prevention is better than cure, and most of the time when they are not feeling well and everything, it's better to pick it up earlier than later, saving you a lot of heartache and money. All right, so we'll start now. This is Aki. As I said, she's a 5-year-old female Maltipoo, and she has always helped me a lot in all this demonstration and teaching, especially during the COVID period. All right, so I'm just going to do a short demo on her, and if you do have a pet with you, do join in. You can bring them along and follow what I do along the way. All right? Okay, Kiki, come on. Let's show people what we do. Okay. So this basic physical examination is really, really easy. This is what I generally do after their walks each day to just make sure that she's all okay and there's no injuries after a walk and there's no new lumps and bumps around her. All right? And this is something that you can incorporate into your daily interaction with your dog. Okay? And this also promotes bonding because at the same time, they will feel like, this is nothing. You're just going to touch my paw today. You're just going to touch me here today, touch me there today. And it's not going to be something bad. All right. So for Aki, what I generally do once again is a head to tail so that I don't miss any part of her at all. And I generally start off with the head. And just want to look at the eyes. Make sure they are bright and clear. Okay. With no discharge and she's not squinting. A little bit of watery discharge is fine, especially if you have noticed it every time, all the time, and it's not like causing her to squint or making her very itchy, and the rims around her eyes are not red. They're not supposed to be red, okay? And there shouldn't be any loss of fur or clumping of hair around. If there is any of such thing, most likely there's too much discharge going on, okay? And then, of course, we move forward to the nose. The nose should be also very nice and smooth. There shouldn't be excessive discharge. If there's a little bit of watery discharge, once again, it's fine. But if there's yellowish or greenish discharge, that's probably something I would want to seek veterinary attention for. Okay, especially if it comes with a lot of sneezing or there's a lot of or if there's a lot of staining around the muzzle and around the nostrils. Next, what else can we do? Next, we would like to check the lips. Kiki, come here. Good girl. Next, we would like to check the lips and make sure that the lips, the areas around the lips have no injuries, no cuts, no lumps and bumps, no staining, no blood staining, and no excessive salivation. Sometimes when an animal gets a piece of bone or a piece of food stuck in between their teeth or getting a piece of steak or grass seed stuck in their mouth, what it will do is it will make them very uncomfortable. and they will start drooling and drooling and drooling and drooling. Sometimes it also happens if they have really, really bad dental health, like really bad teeth, and it will cause them to emit a very offensive and pungent smell from their mouth. But people say, oh yeah, they got bad breath, okay, or there's a lot of salivation around the chin, then you know maybe there's something stuck. So this is also the time to just take a look and make sure it's clean and dry. Kiki, come here. Clean and dry. Touch it. And if it's okay with you, touching it most likely is not very painful. And usually I will also, okay, good girl. I will also do this. I will gently lift up the lid to just look at the gum color to make sure they are pink and nice. Kiki gets her teeth brushed once a day. So she's quite okay with me opening up her mouth and putting my finger into her mouth. She's quite okay with it. And last but not least, I like to open her mouth to take a look inside. Yay, good job! Good girl. You see, I do it without any bad intention. And I do it like, oh, it's fun, it's fun. You are doing so good. I treat for them as well to make sure this is a fun experience. Hey, good girl. You are doing so well. Okay? And this is what I'm trying to bring across. This is something that you should do every single day when there's no issue at all. So that they think that it's nothing, it's fun. Don't wait until there's a problem when you start trying to open your mouth and everything. Then they'll be like, I hate this is scary. And it will be hard to do that later on. Okay? So as you can see, for Kiki, we will really check the eyes, the nose, and the mouth. When I open up her mouth, I'm also trying to see her tongue to make sure there's no discoloration and there's no ulceration and things like that. All right? Kiki. Next, what else have we missed? We haven't checked the ears. This is when I always tell the students, we have to make use of other senses other than our eyes and our touch, okay? Not like dogs that we start licking them, but when it comes to the ears, I like to use my sense of smell. All right? As you know, a lot of dogs in Singapore have otitis external, which is ear infection. So it's always good to just take a look at their ears at least once a week. For me, I check them once a day. Okay, just flip them up. Joey, you are messing up the place. Joey, come here. Sit down first. Okay, good girl. Okay, and for the ears that are drooping down, can flip them up. Take a look around. Make sure that the skin around is not flaky. It's nice and pink, and there's not a lot of discharge, and there's no bad smell. But this is when you will take a small sniff, okay, and just get acquainted with the smell. If it's nice, clean, and pink, all right, it's most likely fine. A healthy ear shouldn't have a lot of discharge at all. Maybe just a little bit of discharge. But if there's any excessive discharge at all, you can be quite sure there's a problem going there, and it's better to get the ears checked out by a vet. QE wants to be part of it as well. So I can just show you again how do I check the head, okay? So once again, check the eyes. Make sure the eyes are fine. Check the nose. Make sure there's no excessive discharge. Check the mouth. Lift up the lip and check the gums. Open up the mouth. Kill. 1, 2, 3. Ah! Good girl. Oh, good girl. And then check the ears. So bring it up and give it a spin. No smell at all. Good girl. Okay. No. More treats. Hold on. Joey, you need to come here first. Sit. Good girl. Good girl. Okay. So after we check the head, next what I like to do is I will always check the head. So the coat and the skin, I'll just run my hand through the skin and the coat, feeling for any lumps and bumps or pimples like that. All right. And if there's any cuts or any strains or sprains, when you touch them around, they may yelp or they may turn around and look. And then that's when you know you should take a closer look at them. All right. So after we have done this, what do we want to do? We will take some time to check the legs as well. So I'll check the front legs. I'll move my hand down each of the leg, and then I will feel the toes around, I feel the paws. Okay, if they are not painful or anything, she shouldn't be quite bothered. But I do understand that some of you may have animals that are quite resistant to them, to people holding their paws, because they're worried about nail clipping and things like that. So this is some of the desensitization things that you can do at home again. Just really gently touch their paws, and when they let you touch, give them a treat. Say, good girl, so clever girl. All right, so I'll do it with one leg first, just feeling the whole leg, feeling the shoulder, making sure there's no any hot spots, any place that feels swollen or anywhere that she's uncomfortable. Then I'll change to the other leg. Wait, hold on. And really just feel it again. You can see she's quite okay with it. And then after that, I'll move backwards. Ayo, what's going on? Come here, darling. She's a very good girl. So after this, we'll just feel her like that, and then we'll feel her abdomen, which is a belly. Okay, and I'll gently just put a little bit of pressure and then just feel it. If there's no belly pain or things like that, she wouldn't be too bothered. You can see she's not tense or anything. It's quite soft, and just pop, just gently, and she's fine, right? And of course, under the belly, you know the skin is unfurred, and then you can see the bare skin. So that's where you can also see whether there's any contact allergy, whether there's pimples there, or whether it's redder than normal or things like that. All right. And then after that, Kiki, we still haven't checked the hind legs. We have to check the hind legs, where we do the same thing as we do with the front legs. Just moving it down, touching the paw, making sure everything's okay. And then the tail. Just make sure the tail has no hot spots, no matted hair, everything is all right. Look at the bum area. Make sure there's no poo-poo stain. If there's fecal stain, you may start thinking, maybe the hair too long. Maybe there's a little bit of diarrhea going on. Okay, if it's a girl, need to take a look at the genitalia. Make sure that there's no excessive discharge, like bloody discharge, yellowish discharge, or greenish discharge. Okay, if it's a boy, if it's an intact boy, just check the scrotum and the testicles. Make sure there's two equal size testicles, and they should be even and nice feeling. Shouldn't have any lumps and bumps around there. And also have to check the penis as well. Okay, no bloody discharge or things like that. If there's a little bit of greenish yellowish discharge, that's normal. Okay. Okay, and now we will show you how to do a physical examination. Once again, a really fast one. So this is something that I really do at home every single day. And as you can see with practice, you can do it in less than 30 seconds on your own pen. All right, so Kyo, can I get your help, please? Come. Kyo, faster. I love you. Don't be so obsessed, darling. Can you do a sit first? Sit. Okay, sometimes they're not cooperative. Kyo is just very, very intrigued by her pet, the hamster. We'll get Aki again. I'll show you how to do it in like less than 30 seconds. You see, she's all ready. Okay, this is what I do again. See the eyes, make sure there's no excessive discharge. The nose, the mouth, the lips, the gums. Open, darling. Clever girl. And then we check the ears. Sniff. Skin and coat, just basically touching it down. All the limbs. The tail and the bum area. And of course, once again, lift them up to check their belly. Baby go up. And make sure the skin is nice and clean. And you're done. Okay? How are you going to know what's abnormal if you don't know what's normal? So this is something that you probably need to do. It will be a good practice for you to do every day with your own pet, so that you know what's normal and versus what's abnormal. And this is the time where you can also build some bond and trust with your dogs. As you can see, Aki is very comfortable in doing anything with her. And she's just like, oh, it's nothing, it's just another day. That's a treat. All right, good girls. You did very, very well, Kiki. And of course, she gets rewarded for it. So it's nothing scary at all. And Kioi is just being very, very obsessed. Kikiona? You don't want? Okay, then Kiki will get it. All right. Now, I will show you guys, as I have said just now, that this is something that you can do for all animals. This is a physical exam that you can do for all kinds of animals that you have at home. Just with some slight modification. And I have Aki with me, I have Kyo with me, and I also have Bam Bam with me. So Bam Bam is a winter white, and he's about 7 months old. And you can see Kyo is really, really, really obsessed with him. Can I take your hamster out, please? I'll show you guys how do I do a physical exam on a hamster. Kyo. Hi, Bam Bam. Kyo, leave it. Bam Bam. No. Good boy. Yeah. There we go. Kyo is fine with the hamster, in case anybody's wondering. Just that she's very, very obsessed with it and she really likes it a lot. And she's just staring at it every single day. Okay, I'll come closer because Bam Bam is really small. So once again, a head to tail examination. We want to make sure we have a routine of where's the head, where's the tail and everything. And we want to make sure we do it systematically so that we do not forget to examine any part. Okay. And practice makes perfect. Sometimes when you first start off, your animal is not used to you handling and everything. It may be a little bit difficult. But once they're used to you doing it, they will be quite accommodating. Okay, Kyo, you're just drooling all over it. No. All right. So this is Bam Bam. He's a 7-month-old winter white. And with hamsters, once again, same thing. Eyes. Make sure there's... Kyo, can you just move away first? Kyo, can? Good girl. Sit. Faster. Kyo, sit. Stay. Clever girl. Okay. So just make sure the eyes are bright and clear. There's no excessive discharge. There's no squinting. The nose should be clear as well. There shouldn't be any excessive discharge. If there's any excessive discharge, you will see it as clumpy hair around the nostrils. Okay. And last but not least, also check the mouth. Of course, right now I can't really check it. But if you want to really check it, use a cotton bud. And then you can just check the teeth as well. And also just make sure the areas around the lips are not very, very wet. If they are wet, they will be also clumpy for the hair. And check the ears, make sure they're not scabby or flaky. And there's no discharge coming out from them. There should be, Joey, can you just leave it? There should be no discharge coming out from the ears. Okay? Bam Bam has some bite marks on his ears. Not from Kioi. It's from his litter mate before we adopted him. All right? And then next, skin and coat. Once again, just feeling through and making sure there's no lumps and bumps and no scabs around. All the limbs, this is when you have to flip them a little bit to just make sure that they have no sore paws or hocks. Okay? As most of you would have seen, Bam Bam is a boy. Okay? So, hamsters, very, very easy. But of course, you do have to handle them frequently to get them used to all this handling. All right? I'm going to put Bam Bam back now. You are so protective, Kiko. Okay. Yes. All right. This actually sums up our virtual workshop for today. And thank you very much for joining us. If you have any questions regarding today's workshop, please leave your questions in the comments below, and I will answer them as soon as I can. And now we will be screening a short video about TPACW, our in-house veterinary clinic, for you guys to see what are the facilities we have for our students doing the Diploma of Veterinary Technology. So once again, thank you for joining me. I'm Dr. Nyopeter of TPACW. This is Aki, this is Kyoi, and that's Bam Bam. Thank you.
Temasek Polytechnic Animal Clinic and Wellness, better known as TPACW. We are a learning enterprise within TP, which offers affordable and quality services for pet owners. Today, we will bring you behind the scenes of our clinic. TPACW is set up like any other regular clinic to introduce our students to a realistic working environment. Trainees are allowed to answer phone calls and take in appointments using the in-house practice management software once they have been introduced and trained by our qualified veterinary staff. SIP students are encouraged to take responsibility for front desk jobs, which include checking in of clients, discharging of patients, and explaining drug administration instructions. TPACW has a spacious consult room which is well equipped with medical instruments. Our vets are experienced and have their own niche. Students standing in to observe the consults are often exposed to the various methods of handling, and they are encouraged to try the methods hands-on. The clinic's imaging services are supported by the state-of-art equipment. We have a digital radiograph machine which produces quality images within seconds. This allows for quick and accurate diagnosis. TPACW's treatment room is where basic procedures such as wound cleaning and stitch-ups are carried out. We have an oxygen concentrator and vaporizer in the room to aid with anesthesia of the animals. TPACW boasts an in-house lab where blood and other samples can be collected and run. This again strengthens the clinic's ability to provide accurate diagnosis in a short time. We have a range of commonly used machines in Singapore so that our students can be exposed to the different types before embarking on their work journey outside of TP. Surgeries are one of the many things which will happen in an animal clinic. TPACW offers surgical sterilization of animals, and all the procedures are carried out by our licensed veterinarians. Students are exposed to strict surgical protocols, which ensure that the surgery is carried out as sterilely as possible to minimize or even eliminate the risk of post-operative infections. Handling of equipment before and during procedures are critical to ensure that the surgery is done as sterilely as possible. Not only do students help to prep the animal and the veterinarian surgeon for the procedure, they are also encouraged to take part in the constant monitoring of a patient under general anesthesia. Vitals such as the heart rate, respiratory rate, and mucous membrane color are monitored at regular intervals and recorded to ensure that the animal is stable throughout the whole procedure. Anesthetic monitoring is aided by our in-house equipment such as the pulse ox, which monitors each breath taken, and the ECG machine, which tells us the heart rate and oxygen saturation level of the patient. And we have the wellness part of TPACW. We have a fun and interesting physio exercise room equipped with a gait analyzer, land treadmill, and exercise equipment for dogs. The examination and treatment are often done in a stress-free environment where treats and praises are leashed out with no holdback. TPACW also has an in-house hydro treadmill. We have a certified canine hydrotherapist too. This equipment helps animals with sickened joints to maintain and build muscles as the warm water allows for weightlessness. Hence, the usually painful animals are able to exercise without pain. Patients are also kept safe from drowning with one of the best canine life vests in the market. Dr. Annie is our trained canine hydrotherapist. TPACW is also a venue for various workshops held throughout the year. These workshops cater to a wide range of audiences, which include the regular pet owner to experienced vets. Our most recent workshop was a dog agility workshop. Students are often involved in our workshops, and most recently, they are also involved in the ultrasound courses held for licensed veterinarian. TPACW staff are also tasked to facilitate pet care management courses, which aim to equip pet owners and pet shop owners the very basics to animal handling and husbandry. Hope everyone now has a good idea of what goes on behind the scenes of TPACW. Happy 20th anniversary ASC! Thank you!